Let's discuss face reading, pharyngitis. Pharyngitis refers to the inflammation of the mucous membrane and lymphatic tissues of the pharynx. According to the time of onset and different symptoms, it is divided into acute pharyngitis and chronic pharyngitis. The causes are mainly a disorderly lifestyle, the fatigue of defensive chi to protect the lungs, and wind heat pathogens invading the throat. Clinical manifestations include pharyngeal discomfort, the sensation of an existent foreign body, pharyngeal secretions that are hard to spit out, sensations of itchiness, burning, dryness, or irritation of the pharynx, and occasional slight pain. Acute pharyngitis, which is often a viral or bacterial infection, is more common in winter and spring, while chronic pharyngitis results from repeated episodes of acute pharyngitis. Face reading. Sudden redness of both earlobes without stimulation indicates inflammation of the tonsils. If black spots appear in the earlobes, it may indicate chronic pharyngitis. Therapeutic methods. To treat pharyngitis, chronic pharyngitis in particular, patients should follow the principle of 30% treatment and 70% daily care. Dietary advice: do not eat spicy, pungent, fried, and pickled foods, quit smoking and consuming alcohol, and eat foods rich in vitamins and those that aid in clearing heat, soothing the pharynx and relieving thirst, such as kiwi fruit and watermelon. Exercise: get plenty of exercise to strengthen the body's resistance, but do it in a warm afternoon when the temperature has gone up and the dust concentration has been reduced. Lifestyle: make sure that you get plenty of sleep, avoid late night, and speak less. Brush your teeth in the morning and at night to keep your oral cavity clean. Medicinal dietary therapy. Consume lily bulb, banana, and white fungus soup. Lily bulbs and dried white fungus 30 grams each, 2 bananas, Chinese wolfberries, and rock sugar. Peel the banana skin and cook the flesh in water with lily bulbs, soaked with fungus and Chinese wolfberries. Add the rock sugar to improve the taste when the soup is ready. This soup nourishes the lungs and is suitable for patients with pharyngitis. Massage. Massaging the Jinghu point helps alleviate coughing, pharyngitis, and sore throat. In modern medicine, this massage method can be used in the prevention of respiratory diseases such as bronchitis, pneumonia, pharyngitis, and tonsillitis. Use the pad of the middle finger to knead the Jinghu point for 3 minutes 3 times a day. Thank you for your attention.
Let's proceed to interviewing with a case history of migraine. Our patient here is a 28-year-old woman who had been suffering from migraine since the age of 13. She was thin, was quite tall, and walked with agility. Her body shape was a typical wood type. Her complexion was dull sallow, her hair was dry, and her eyes had good sheen. The headaches were of a throbbing character and always occurred on the left side of the head, along the gallbladder channel, and behind the left eye. They occurred weekly and nearly always accompanied by nausea, vomiting, and photophobia. The headaches was not affected by posture or food intake, and although a headache always occurred with her period, she also suffered from headaches at other times. The headaches were aggravated by damp and windy weather and also by stress and fatigue. A striking feature of the headaches was that they were marked better during 2 pregnancies and marked worse on after childbirth both times. She had 2 children, one 3-year-old and one 6-month-old. An electroencephalogram and computed tomography scan revealed no abnormalities, and drugs for migraine produced an aggravation. The periods were quite normal, coming regularly with normal amount and color, but rather painful in the first 2 days. Her general health was good, with no abnormalities in urination or defecation or sleep. Her tongue was very slightly pale but red on the sides, swollen with a sticky coating, and there was small peeled patch on the left side in the breast area. Her pulse was generally weak and empty at the deep level. Now let's look into the diagnosis. Observation of her body type indicates that she is a wood type. Her agile walk across accords with this, which is a good sign. Each five-element body type has a characteristic walk, and a deviation from this is not a good sign. For example, the wood type should walk in an agile way, and if they walked stiffly, it would not be a good sign. Her dull complexion and dry hair suggest blood deficiency. The normal sparkle of her eyes suggested that she did not suffer from any deep emotional problem. The marked amelioration during pregnancy and aggravation after childbirth strongly suggests a deficiency of the kidneys and the disharmony of the penetrating and directing vessels. This is confirmed also by the onset of the headache soon after menarche, which occurred when she was 12 and a half years old. We therefore need to confirm the presence of blood deficiency and kidney deficiency with further questioning. Confirm or exclude blood deficiency, we ask about numbness and tingling of the limbs, dizziness, poor memory, insomnia, blurred vision, and she did suffer from tingling of her limbs, but from none of the other symptoms. However, we can conclude that there is some blood deficiency from the tingling of her limbs, the dull complexion, and the dry hair. As for the kidney deficiency, she had no symptoms of it apart from lower backache, and this symptom, together with the onset of the headache at menarche, the amelioration during pregnancy, and the aggravation after childbirth, confirms the presence of a kidney deficiency and the disharmony of the penetrating and directing vessels. Thank you for your attention.
Let's discuss acupuncture analgesia, central mechanism, molecules, and receptors, part 2. N-methyl D-aspartate acid, NMDA receptors. Glutamate and its receptors, such as the NMDA receptor, are part of the mechanism in the transmission of painful stimuli. Antagonism of NMDA receptors with agents such as ketamine and nitrous oxide are known to reduce subjective pain and are common agents used in anesthesia and analgesia. EA reduced the expression of NMDA receptors in rats, and NMDA receptor inhibition enhanced the effects of acupuncture analgesia. Research suggests that acupuncture may block NMDA receptor and decrease nociception. Other neurotransmitters. There are still various neurotransmitters under investigation, many including noradrenaline, aminobutyric acid, or GABA, and substance P have been implicated in the mechanism of acupuncture analgesia, but substantial data is lacking and sometimes contradictory. Few studies suggested that angiotensin, somatostatin, arginine, vasopressin, and neurotensin may indirectly affect anti-nociceptive effects of acupuncture. Further studies will be needed to clarify their roles in acupuncture. Cyclooxygenase 2 or COX-2 in animal models of neuropathy and inflammation. Recent studies suggested that acupuncture decreased the inflammatory process, thereby reducing pain. Using spinal cord glia, which plays a part in the inflammation and neuropathic pain, Sun et al. Showed increased acupuncture analgesia when glia metabolism was inhibited. Mice induced with Parkinson's disease had decreased microglial and COX-2 activity with acupuncture. The mechanism of acupuncture analgesia may include reducing inflammation via inhibition of glial cells and COX-2 enzymes. Liu et al. Has shown that acupuncture may inhibit COX-2 in the spinal dorsal horn, where COX-2 is unregulated after the development of neuropathic pain following spinal nerve ligation, SNL. After L5-SNL, the rats were treated either with acupuncture applied at Susan Lee and San Jiao bilaterally with or without electrical stimulation 4 times over 22 days and or celecoxib fed daily. EA had a long-lasting and better analgesic effect than celecoxib in reducing neuropathic hypersensitivity through COX-2 expression in the spinal dorsal horn by immunostaining was significantly reduced by acupuncture and celecoxib, and the superior analgesic mechanism of acupuncture appears well beyond COX-2 inhibition alone. Thank you for your attention.
Let's proceed to the differential diagnosis of herpes in Western and Chinese medicine. Let's start with the Western differentiation. First, here we have herpes simplex virus type 1. Its primary function causes painful ulcers inside the mouth in a child of 1 to 3 years old. HSV1 lies dormant for months or years until cold sores appear. Attacks triggered by emotional upset, fatigue, and tiredness, colds, or other viruses that weaken the body's defenses, premenstrual periods, strong sunlight, cold winds, and it is contagious. Next type is herpes genitalia, or HSV2. It is infection similar to HSV1. 50% of herpes genitalia are due to HSV1. There is painful ulceration, dysuria, painful vaginal or urethral discharge. There is fever, myalgia, swollen lymph glands, and symptoms probably more severe at initial attack than subsequently. This is also contagious. The third type is herpes zoster or shingles. This is acute localized infection with varicella zoster virus, causing painful blistering rash. Following chickenpox, the virus remains latent for years in the nerve tracts that emerge from the spine. When reactivated, it spreads along the nerve tract, first causing pain or a burning sensation. Symptom progressions are the following. It will start with tingling sensation in the affected area. Fever and malaise may be present, erythema followed by blistering of the skin. After 5 days, a one-sided rash appeared, often over the ribs. There will be blisters, turn yellowish, flatten and dry out, and crust over. And then post-therapeutic neuralgia may occur following an attack due to nerve damage. Now let's go to the Chinese differentiation. In herpes simplex or herpes genitalia, there will be itching lip and genital pain, swelling, possible fever, thirst, frontal headache of wind, heat, or damp causes, lesions with red margins, pain, burning, myalgia, dry mouth, bitter taste, or no thirst. There will be low-grade fever, constipation, reddish yellow urine. If there is wind damp heat in the spleen and stomach with temporal headache, there will be irritability, tooth grinding, myalgia, red eyes, facial flushing, dizziness, bitter taste. If there is stagnation of liver qi and liver fire blazing. In herpes zoster, there is acute red painful blisters, fever, if there is damp heat or toxic pathogen invasion. If there is large fluid-filled blisters, it means there is dampness. In the late stage, there is shingles, dry skin, pain, old blisters flaking, if there is chi and blood stagnation. Now let's go to its etiology. In simplex or genitalia herpes, its etiology is on fatigue, overwork, exposure to virus, windy, sunny climate, cold, flu, damp, heat-producing foods, anger, and frustration. Herpes zoster has its etiology on chickenpox, invasion of external pathogen, damp, heat-producing food, tiredness, and old age. For the Zangflu patterns, herpes simplex or herpes genitalia has an excess pattern in wind heat invading the channels, damp heat in spleen, damp heat in stomach, and liver fire blazing. For deficiency patterns, we have stomach-kin deficiency with empty heat and spleen chi deficiency. In herpes zoster, it could be due to damp heat in the liver, damp heat in gallbladder, accumulation of dampness, and chi and blood stasis. Thank you for your attention.
Let's continue our discussion about relationships among Zang viscera. The lung and the kidney. The relationship between the lung and the kidney is demonstrated mainly in two aspects. First, respiration. The lung controls qi and respiration, and the kidney stores qi. These two organs work together to ensure that respiration is carried out completely. When the kidney's essential qi is vigorous, the lung can send inhaled fresh air to the kidney, and the kidney can receive it. Only then can respiration be even and deep. Thus, the lung is the governor of qi, while the kidney is the root of qi. If the kidney fails to accept qi, qi will remain floating above. There may then be coughing, shortness of breath, and rapid breathing. Even the slightest exertion may exacerbate the labored breathing. Second is water metabolism. The lung is the upper source of water. It has the functions of dispersion and depuration and of the regulation of the water passages, so that water in the upper jaw can descend to the kidney. The kidney is the organ that controls water metabolism. Its functions are to transform qi and to raise the clear and send down the turbid. Thus, these two organs work together to maintain equilibrium in water metabolism. Any abnormality in either organ can affect the other. If the lung loses its ability of dispersion and depuration and its regulation of water metabolism, the kidney's functions are also disrupted. In this state, there may be such symptoms as edema and oliguria. Loss of control over water by the kidney can lead to water attacking the lung. This is known as cold water shooting at the lung. There may be edema, severe coughing, and labored breathing. So here we see the relationship between the lung and the kidney. The lung governs the qi, is the upper source of water, while the kidney descends to transform water and governs water metabolism. The lung then must function properly as respiratory activity for water metabolism to go down properly to the kidney. Thank you for your attention. Diagnosis according to Zangfu organ patterns. Let's talk about kidney imbalances pathology. If the kidneys are out of balance, it will manifest with a weakening or dysfunction of one of the aspects or physiological functions that relate to the kidneys. Kidney imbalances can be reduced or simplified to two main imbalances: kidney yin deficiency and kidney yang deficiency. Kidney yin encompasses kidney jing, and kidney yang encompasses mingmen and kidney qi. Kidney jing is used to create bones, cartilage, teeth, and hair. If there is a congenital jing deficiency, the person will often have a weak bone structure, weak teeth, and thin hair. The growth and the transition to puberty, etc., are controlled by jing. Jing deficiency can be seen when there is slow development, poor growth, mental underdevelopment, and a child enters puberty late or not at all. A girl who does not start menstruating or only starts menstruating late in puberty may well be Jing deficiency. Jing also manifests in the sperm and eggs. Infertility and low sperm counts can therefore be a manifestation of Jing deficiency. The brain is a flower blossom on the spine and it is created from Jing. Jing therefore has an influence on the brain's activity and structure. Congenital problems that manifest with poor development of the mental faculties are often related to Jing deficiency. In fact, most congenital problems and genetic defects have a Jing deficient aspect. If the brain is not nourished by kidney Jing, it can cause problems with the memory, concentration, and dizziness. Kidney yin nourishes heart yin, helping to anchor the Shen. Kidney yin deficiency can therefore manifest with insomnia, as well as anxiety, mental restlessness, and a sense of unease. The kidneys have a great influence on the bones, especially in the lumbar region and the knees. The bones are created and nourished by kidney Jing. Kidney yang in turn strengthens the bones and warms the lumbar and the knees. This means that weakness, soreness, and a cold sensation in the lower back and knees can be seen in kidney imbalances. Fluid physiology is dependent on the kidneys. Kidney yang is used to transform and transport fluids in the body. When there is kidney yang deficiency, the deficiency of the yang will affect these processes, resulting in edema or increased urination. The increased frequency and volume of urination that is characteristic of kidney yang deficiency is due to this failure to transform and transport fluids optimally, as well as kidney yang being used to hold urine in the urinary bladder. This means that incontinence, enuresis, and nocturia can also be a manifestation of kidney yang deficiency. Kidney yang is also the force behind the expulsion of urine out of the urinary bladder. Kidney yang deficiency can manifest with urinary difficulties, a weak stream of urine, or dribbling when urinating. The poor transformation and transport of fluid in the body when there is kidney yang deficiency will result in the untransformed fluids seeping down to the lower jaw due to their yin nature. These fluids will accumulate in the urinary bladder, increasing the amount of urine and diluting it so that it is paler in color. The urine will be darker yellow color and more scanty when there is kidney yin deficiency, because there will be less fluid in the body, making the urine more concentrated. If there is yin deficiency heat, the heat will further concentrate the urine and make it even more dark and sparse. Kidney yang also affects other aspects of fluid physiology. Kidney yang is the root of Wei Qi. If kidney yang is weak or deficient, there may be problems controlling the pores in the skin. Spontaneous perspiration or sweating upon light activity can therefore be a sign of kidney yang deficiency. Kidney yin deficiency can also result in sweating disturbances. Night sweats are a classic manifestation of kidney yin deficiency because yin has become too weak to control heat, especially at night, when yin should be more powerful than yang. The resultant yang heat will expand upwards and outwards, driving fluids up to the surface of the skin. At night, Wei Qi circulates in the interior and therefore cannot keep the sweat inside the body. Thank you for listening.
Let us now go to pathology in Chinese medicine. The topic is internal and external environment and pathogenesis. In internal and external environment and pathogenesis, the condition of genuine qi depends upon a number of factors. Most importantly, the constitution, the psychological state, the living environment, the nutritional status, and physical training. Constitution. In general, the state of the body's constitution can be highly significant in determining whether a person becomes ill or not. Many people are exposed to the same pathogenic evils, yet some fall ill and many do not. Among those who do fall ill, the severity and the course of illness vary because of differences in constitution. Thus, for example, when wind and cold invade the exterior of the body, some patients may develop an illness of exterior deficiency due to an invasion, whereas others may develop an illness of exterior strength due to cold injury. In CM, three factors principally contribute to a person's body constitution. Of these, the first and most important is heredity. The state of parental constitution, to a large extent, determines the state of the offspring's constitution. The fatness or thinness of the body also influences the state of the person's constitution and may affect the pathological changes of illness in the person. For example, a fat person tends to have a relatively deficiency of yang. When such a person falls ill, the illness is more likely to be one of dampness or phlegm, which are yin type of illnesses. Conversely, a thin person tends to have a relative deficiency of yin. When such a person falls ill, the illness is more likely to be one of fire or excess qi. A person with a constitution of relative deficiency of yang or abundance of yin is likely to develop symptoms of yin cold and to have pathological changes of cold illnesses. Conversely, a person with a constitution of relative deficiency of yin or abundance of yang is likely to develop symptoms of yang heat and to have pathological changes of heat nature. In addition, the state of constitution also varies with age. There is a definite correlation between age and illnesses. For example, a young child has a constitution of immature yin or immature yang. When yang qi first begins to increase in childhood, it tends to move readily. The child is more susceptible to heat and wind, and the body fluids are more easily injured. During the youthful years, the body tends to be stout and the constitution strong, so that qi and blood are ample. When pathogenic evils attack, there is a vigorous defense, so that most illnesses are those of evil strength and of heat. In senescence, qi and blood both decline, leading to relative deficiency of original yin and yang. When illnesses occur, they tend to be of deficiency cold. This discussion shows that the constitution is inseparable from pathogenesis and the course of illness. Thank you so much for your attention. We'll go to pathology of minister fire and emotional problems. The topic is full heat and empty heat. Full heat. Full heat as a result of emotional stress derives usually from long-term qi stagnation. When qi stagnates for some time, it may give rise to heat. However, in emotional stress, heat may also be formed independently. This may happen, for example, with anger, joy, love, or craving. The main manifestation of full heat is the tongue. This is red and with a yellow coating. If the tongue body is red and there is a coating with root, there is full heat, even if the coating is not yellow. The other important manifestation is the pulse. In full heat, the pulse is full in general, which may include wiry, overflowing, big, or firm. It should also be rapid, but it frequently is not. Other clinical manifestations include feeling of heat, thirst, dry mouth, insomnia, agitation, mental restlessness, and red face. Full heat of any organ may overstimulate the coming and going of the ethereal soul, and it may therefore lead to manic behavior, agitation, mental restlessness, insomnia, hyperactivity, and anxiety. In summary, full heat from emotional problems will cause feeling of heat, thirst, dry mouth, insomnia, agitation, mental restlessness, red face, manic behavior, hyperactivity, and anxiety. The tongue will be red with a red tip and a yellow coating, and the pulse will be overflowing rapid. Empty heat. Empty heat derives from yin deficiency. It is important to note that although empty heat derives from yin deficiency, eventually yin deficiency may occur for many years without empty heat. Empty heat is seen in emotional stress when this is combined with overwork that leads to yin deficiency. It is a relatively common situation in Western patients. The combination of overwork with emotional stress leads to yin deficiency and empty heat. Thus, in such cases, the empty heat does derive from yin deficiency, but it is aggravated by the emotional stress, which in itself leads to heat. Most of all, the emotional stress causes the empty heat to rise more, causing agitation, red face, and thirst. In empty heat, the tongue is red, but either without a coating, totally or partially, or with a rootless coating. Thus, in full heat, the tongue is red with a coating, and in empty heat, it is red without a coating. In empty heat, the pulse is floating empty and rapid. Other clinical manifestations include feeling of heat in the evening, dry mouth with desire to drink in small sips, malar flush, mental restlessness, and insomnia. As full heat does, empty heat of any organ may also overstimulate the coming and going of the ethereal soul, and it may therefore lead to manic behavior, a vague mental restlessness, insomnia, fidgetiness, and anxiety. The mental restlessness from empty heat manifests differently to that from full heat. In empty heat, the patient has a vague feeling of anxiety and restlessness that also manifests more in the evening. In summary, empty heat from emotional problems causes feeling of heat in the evening, dry mouth with desire to drink in small sips, malar flush, insomnia, manic behavior, a vague mental restlessness, fidgetiness, anxiety, red tongue without coating or partially without coating, a red tip, and a floating empty and rapid pulse. Thank you so much for your attention.